Hello, we are presenting intraocular pressure accuracy, post-myopic laser in situ keratomileusis. This is a pivotal study results of the standard versus modified Goldmann tonometry. Disclosures are as listed. The only relevant disclosure in this presentation is that of Sean McCafferty being an equity owner in CAT's tonometer. Numerous studies have shown that LASIK leads to a significant reduction in postoperative Goldmann applanation tonometry. LASIK is known to modify the biomechanical properties of the cornea. A correcting applanation tonometry surface, the modified prism, is an adaptation of the standard flat-surfaced Goldmann applanation tonometry prism, designed to reduce the IOP measurement inaccuracies associated with the standard prism. Clinical studies have shown that the modified prism is less affected by variations in central corneal thickness, corneal hysteresis, and tear film. The purpose of the study was to quantify Goldmann IOP error relative to intracameral pressure in LASIK subjects. Also, to quantify clinical differences between standard and modified Goldmann prism intraocular pressure measurements in LASIK subjects. And finally, to validate the modified prism's accuracy using manometric comparisons in these myopic LASIK eyes. The study protocol is designed to validate the modified prism's claims of improved intraocular pressure measurement compared to the standard Goldmann prism in patients who have undergone myopic LASIK. Two studies are part of a bifurcated justification. 1. As intracameral pressure is not a feasible option in live LASIK subjects, a LASIK cadaver eye study comparing a true standard intracameral pressure to both the standard and modified prism measurements was designed. 2. A clinical study across representative myopic LASIK patients was used to validate the cadaver findings to demonstrate a similar difference between standard and modified prism pressure measurements, as was found in the cadaver study. This was designed as a prospective cross-sectional cohort study and an in vitro cadaver comparison. There were 198 eyes were enrolled from 100 subjects who had previously undergone myopic LASIK. Separately, 18 enucleated globes that previously had undergone myopic LASIK were examined. LASIK subjects were enrolled from 3 investigative sites, obtaining IOP measurements by Goldmann with standard and modified prisms by multiple practitioners per ISO standardized procedures. Using the same methods, IOP measurements were taken using 18 enucleated globes that had undergone LASIK by 2 practitioners at the manometric pressures of 5, 10, 20, 30, 40, and 50 millimeters of mercury. In the LASIK cadaver study, across all IOP measurement levels, in the cadaver study, the modified prism is more accurate than the standard Goldmann prism by being closer to intracameral pressure. It is noted that the IOP error is pressure dependent, but to a lesser degree with the modified prism. In the clinical verification, the mean modified prism measurement was 1.5 millimeters of mercury higher than the standard prism measurement clinically, with a p of less than 0.0001. In the multivariate analysis, none of the predictor variables appeared to affect the relatively higher measurements from the modified prism over the standard prism, nor is there any difference in IOP measurement repeatability between the 2 prisms. In conclusion, the study examined the clinical IOP measurement differences, repeatability, and safety of the modified Goldmann tonometer prism compared to the reference standard Goldmann tonometer prism in myopic corrected post-LASIK patients. Both the clinical study and the in vitro cadaver study provided statistical evidence that the modified prism is a more accurate and more repeatable and as safe as the standard prism in myopic LASIK patients. Prior cadaver and clinical studies have demonstrated that the modified and standard prisms measure a substantially equivalent IOP on average healthy, unaltered eyes. The modified prism improves the clinician's ability to detect ocular hypertension in LASIK patients, reducing the risk of undiagnosed glaucoma. Due to similar corneal and biomechanical alterations, these findings may extend to other refractive surgeries or thin cornea populations, warranting further study. Modified prism adoption could refine post-operative LASIK IOP monitoring, impacting practice guidelines and patient outcomes. Thank you.